Welcome to this tutorial video. So in today's session, we'll be looking at the menstrual as well as the ovarian cycle. So we'll be looking at the menstrual cycle and then we'll also be looking at the ovarian cycle. So the menstrual cycle and the ovarian cycle, they are taught usually at the same time. Okay, so this topic is one of those which you'll find if you're at college level doing your diploma programs. You'll be able to find this topic in human anatomy and physiology. Then those that are doing their BScs programs, you still find this in the anatomy course. Okay, so we'll be looking at the menstrual cycle as well as the ovarian cycle. And before we even start, I would just like to re-emphasize that the reason why you are learning about this topic is simply because at the end of the day, you will be able to graduate and then you become nurses, you become midwives, you become public health nurses. So you find patients out there that will be asking you questions to do with fertility. Maybe they're having challenges in giving birth. Maybe they're having challenges in timing, when they can have those kind of things in bed, which can help them to be able to, have children and everything. But the only way you'll be able to give them proper information is if you understand how the menstrual and ovarian cycle works. Besides that, it's not just about fertility stuffs, but there are also disorders that come in relation to the menstrual and ovarian cycle. And you can only spot them if you understand how these different cycles work. So that's basically why we're going to be talking about these things. Okay? So to start with, if you're talking about the menstrual and ovarian cycle, what you should keep in mind is that there is really nothing that is complex about these two, concepts. Okay? Take note that the menstrual cycle and the ovarian cycle are two different cycles. They are not the same. Okay? But what I just want you to know is that there is nothing that is too complex about these two different concepts. What is basically going on here is that as you are talking about the menstrual and ovarian cycle, they basically prepare a mature, I'm using the word mature, meaning I'm talking about a female who has reached puberty. Okay? They are just basically preparing a mature female person for what? For pregnancy. So the reason why there is the menstrual cycle and the ovarian cycle is that they're just bringing about pregnancy preparation. You will see in which I'll be talking about the menstruation phase and the part which I'll be talking about the follicular phase and everything. But for now, just understand that the reason why these cycles are there, they're just trying to bring about pregnancy preparation. So as we run through, I'll be talking about the menstrual cycle and then I'll also be talking about the ovarian cycle. Once again, do not forget to subscribe to this YouTube channel for more upcoming videos. So let's begin. Okay. So you can see here, I'm showing you this picture. I'm sure that some of you have already, started to think about what is going on here. So before we even talk about the menstrual and ovarian cycle, we must first review the female reproductive system, because it is in this particular system where these different cycles are taking place. So we can't skip that. All right. So you can see that this is basically the internal female genitalia. We have got the ovaries there. We've got the fallopian tubes there. Okay. We've got the uterus there, the vagina there. And then there's something that you can see, I believe. You can also see that blood is being shed off from this uterus lining. Very soon you will understand how this blood, is being shed and how everything is coming about. I just want you to appreciate that as you are talking about the ovarian and menstrual cycle, you must keep in mind that you must always refer to the female reproductive system. Of course, this is not the males, right? Yes. So that is the female reproductive system. We'll be referring to it as we talk about this particular cycle. Okay? So, showing you a label diagram, this is what I mean. So, we're just reviewing the female reproductive system because if we want to understand the ovarian and menstrual cycle properly, then we must be very familiar with the female reproductive system. Okay? I think I've already labeled this in the previous diagram, but just to confirm, you can see that these are the ovaries. And whenever I'm talking about the ovarian cycle, always think of the ovaries. Remember I said that the ovarian cycle and the menstrual cycle, they are not the same. They take place at the same time simultaneously, but they are different cycles. You understand very soon. So there are ovaries there. You can even see that here again, there's also an ovary, right? Two of them normally. And then we've got also the uterus here, the uterus lining. So whenever I'm talking about the menstrual cycle, what you should be thinking about is the uterus. The uterus. Now, I know that some of you already have got prior knowledge about the uterus. You know it has got different layers and everything. Yes. So, the uterus has got three different layers. Okay, on the outer side, there's what we call the perimetrium. Then on this particular thick side, okay, there's what we call the myometrium. Then the innermost layer now, which is being shown here, we call it the endometrium. So the endometrium is the innermost layer of the uterus. And as we're talking about the menstrual cycle, this is the layer which we're interested in. You'll see very soon. So for now, I just want you to take note of this structure that I've mentioned. One, I've said take note of the ovaries, because as we're talking about the ovarian cycle, I'll be referring to these ovaries. And then take note of the uterus, okay? And specifically the endometrium, the innermost layer of the uterus. This is what I'll be referring to as I'm talking about the menstrual cycle. So we've reviewed the female reproductive system. Let us make progress and see what is next. So besides that, I just also want you to keep in mind that I'm still showing you the female internal genitalia, right? This is the female internal organ. Okay? It's showing internal organs. Of course, these are the ovaries, you can see. This is the fallopian tube. This is the uterus. Now, remember I said that on the uterus, we are interested in the innermost layer, and that is the endometrium. Because if we were to label this part here, the outer part, this is going to be our the perimetrium, the outermost layer. Then if we go in this layer here, this one I'm pointing at, that is the myometrium. But as we're talking about the menstrual cycle, we are interested in the innermost layer here, which is what? The endometrium. Now, have you ever wondered why the blood will start coming out during the menstruation phase? Have you ever wondered why? Where is that blood coming from? Is this tissue of the endometrium being degraded? The answer is this particular endometrium, the innermost layer of the uterus, is lined with the blood vessels. There are small, small blood vessels or arteries which we refer to as the spiral arteries. So when these spiral arteries start to burst okay, the kind of rupture, I'm going to explain how this is coming about. They are the ones that bring about the menstruation phase during the menstrual cycle. So for now, I just want you to take note that this is the uterus. Then the innermost layer, which is the endometrium, is having some small blood vessels, which we refer to as what? The spiral arteries. And if you wanted to be specific, there's what we call the stratum functionalis layer. It's one of the layers that you're going to find in the endometrium. It's the one that is having these spiral arteries. And whenever there's the menstruation phase, it's basically these spiral arteries which are basically rupturing, bringing about menstruation. So we're going to understand very soon. We have entirely reviewed the female reproductive system. Recap. I said be interested in the ovaries, the two ovaries. Why? Because that is where the ovarian cycle is taking place. Of course, we can't skip the uterine tube, right? The oviduct or the fallopian tube. They are part of this as well. We're going to talk about them briefly. Okay? Then there is also the uterus. And I've said on the uterus, we are not interested in the perimetrium. We are not interested in the myometrium. However, we are interested in the innermost layer, which we refer to as what? The endometrium, which is having these small spiral arteries, which are basically part of the stratum functionalis layer. And they will be the ones that will be rupturing, bringing about the menstruation phase as we talk about this particular menstrual and ovarian cycle. All right. So to start with, by definition, we are saying that, remember I said the menstrual cycle and the ovarian cycle, they're not the same. So basically, they have different definitions. So I said the menstrual cycle is a series of events. So some people get confused. If you're talking about menstruation itself, the menstruation period, it's not the same with menstrual cycle, because the menstrual cycle, it's an entire cycle, and then that menstruation phase which bring about blood being shed off is just a component of the menstrual cycle. So it's not the same. The menstruation phase is not the same as the entire menstrual cycle. So what I'm defining here is the entire menstrual cycle. So the menstrual cycle is a series of events, okay, or a series of natural changes in hormone production and the structures of the uterus and the ovaries of the female reproductive system that makes pregnancy possible. Remember I said the reason why there is this particular cycle is just trying to bring about making pregnancy possible. So why are we saying it is a series of natural changes? One, I'm just trying to make this definition make sense. One, when somebody is undergoing the menstrual cycle, it's not a disorder. No wonder we're saying it's a natural change. That's how God structured it. Okay, so it's a natural change. So when this menstrual cycle is taking place, is bringing about a change in hormones. You must acknowledge, especially at your level, that this menstrual cycle is being, moderated. Okay, I can use that particular term by different hormones. We'll talk about the hormones very soon. It just doesn't happen on its own. There are hormones that are influencing what is happening in this particular cycle. No wonder we're saying it is a series of natural changes in hormone production and the structures of the uterus. So there will be changes in the uterus as this cycle is running. And one example I can give is that which is bringing about the blood being shed off, the menstruation, phase. So there will also be changes that will be taking place in the uterus as well as what? The ovaries that are basically preparing now this particular female for pregnancy. So we are saying that the menstrual cycle is a series of natural events that bring about changes in hormone production. There will be changes in hormone production. There will also be changes in the uterus and ovaries that are basically doing what? Preparing a female particular person or the female reproductive system for pregnancy. So that's what the menstrual cycle is. All right. Then we're also talking about the ovarian cycle. Remember the title. So the ovarian cycle is basically a phase. It's a phase of the menstrual cycle. So within the entire menstrual cycle, you find the ovarian cycle. All right. So it's a phase of the female menstrual cycle. This one basically involves the release of an egg or ovum from the ovaries. So if you're talking about the ovarian cycle, you're talking about a cycle that is bringing about formation, maturation, and release of the female ovum. Others say the female egg, others say the oocyte. Okay? They are bringing about one production, okay, apart from the production, maturation, and release of the female ovum and egg, okay, from the ovaries. So at your level as BScs or at your level as diploma nurses and everything, you must understand how is this particular egg developing? How is it coming about? Because that is the only way you'll be able to make proper diagnosis on the patient. That is the only way you'll be able to make proper advice with different patients that you'll be meeting if you understand how this particular ovarian cycle and menstrual cycle works. So that is what we're talking about. Recap on this slide, we've said that the menstrual cycle is a series of natural changes in hormone production as well as the structures in the ovaries and uterus that are basically preparing the female reproductive system for pregnancy. Then the ovarian cycle is basically a phase of the menstrual cycle that is bringing about the release and maturation of what? The female ovum or egg from where? The ovaries. This is why I emphasize that whenever I'm talking about the menstrual cycle, always think of the uterus. As you're watching this video, if I mention the menstrual cycle, think of what is happening in the uterus. If I talk about the ovarian cycle, think of what is happening in the ovaries. So that's what we're talking about. Now, this particular slide that I'm showing you is almost summarizing everything that you need to know on the menstrual and ovarian cycle. So I know that some of you have already been told that, okay, the menstrual cycle runs from this particular day to this particular day normally. Others are going to say 35 days. Others are going to say 21 days. Others 28. Others 30 days. There are all those different patterns of how this menstrual cycle and this ovarian cycle works. Now, I want to make your life very simple here with regards to understanding this topic. I mentioned earlier that the menstrual cycle and the ovarian cycle are basically two different cycles. They are not the same. Then the other thing that I want you to acknowledge from here, starting from here, is that whenever there's something that is taking place in the menstrual cycle, there is usually something that is also going on in the ovarian cycle at the same time. It simply means that the ovarian cycle and the menstrual cycle, they run at the same time, but there are a lot of different events that are taking place in each individual cycle. And once you understand those particular situations or those particular events, it's easier for you to answer questions on the menstrual and ovarian cycle. Otherwise, I can assure you that if people don't understand that how the menstrual and ovarian cycle works hand in hand, how the link is, then these are issues which even bring about breakups in marriages. These are issues which bring about divorce in marriages. Why? Because a man would say, for example, a man would say, okay, me, I left on this particular day. We had nothing. So how come you got pregnant? But if a female person understands how the menstrual and ovarian cycle work and how they are interlinked, they'll be able to give a proper explanation. So taking interest in what I'm going to talk about here, because this is where now the entire concept of the menstrual and ovarian cycle is. Now, to start with, I would like to mention that before we even go to these different diagrams here, I'd like to mention that there is no specific date or there is no specific number that is best for describing how long the menstrual cycle runs. So, what you have to know is that among all those different numbers that people mention, 30, 35, 21, 28, 23, 25, we in science, we use one average date, and that is 28 days. So 28 days will be the reference number that we're going to be using as the average number of days for the menstrual cycle in this particular session. So we're going to be using 28 days. If you find that somebody else is teaching and they're using 30 days, they just decided to, but the average number of days in the menstrual and ovarian cycle is 28 days. So we'll be using 28 days. And in these 28 days, you must understand what is happening in the menstrual cycle. You must also understand what is happening in the ovarian cycle. All right. So to make life very simple again, you may also come across questions that are saying, then if the average menstrual cycle is 28 days, then what is abnormal? So some of you have heard that there are people who have got the short menstrual cycle, the short phase. And then there are those that have got the longer menstrual cycle. So I would like to state that anything that is below 21 days, so the menstrual cycle that is below 21 days is considered as short. Actually, let me rephrase that again, okay? Because I didn't phrase that in the correct way. What I mean is this. Anything that is from 21 days to 35 days is considered normal. Anything that is from 21 days to 35 days is considered normal. And in this particular range, we said we are using the average number as 28 days. So 28 days, we're just using it for this particular class. But anything that is 21 days, 22 days, 23, 25, up to 35 days is just okay. But if the menstrual cycle is less than 21 days, that is now abnormal, because that is now too short. Chances are there are hormonal imbalances that are making this cycle to be very short. There could be other situations or other disorders that are influencing or making this particular cycle to be, very short. If you know somebody who has got a cycle which is less than 21 days, try to advise them to seek medical care. Then again, if the cycle is also above 35 days, that is too long. We said the normal range should drive from 21 days up to at least 35 days. Okay? Not more than 35 days, not less than 25 days. So anything again that is above 35 days, that is abnormal. Okay? So what is considered short is from 21 up to 28. That is short. From 28 up to 35, that is long. The average being 28 days. So take note of those numbers that I've mentioned. Alright, so let's talk about what is going on here, because I believe you can see that there's this particular picture which is showing menstruation. There's this particular picture which is showing follicular phase. Then there's this particular part which is showing ovulation phase. And then there's this particular part which is showing the luteal phase. Now, don't get confused here. I'll be talking about what is happening in the menstrual cycle. Then I also talk about what is happening in the ovarian cycle. Why? Because the way this cycle operates is that When something is taking place, for example, from day 1 up to day 14 in the menstrual cycle, then something again is also taking place in the ovarian cycle from the very day 1 up to day 14. So that is what you must understand. Such that if anything was to happen, it may not just be a patient, even you'll be able to explain things to say, this is what science says. So if this happened, then this is possible. You know what I mean, right? So I'll start first talking about the menstruation or the menstrual cycle. Then after I talk about the menstrual cycle, then I'll talk about what is happening in the same number of days in the ovarian cycle. So, given the fact that we're using 28 days, from day 1 we run the cycle up to day 28. So, day 28 days is the number of days that we're using as average number of days. So, we're going to start from day 1. We're going to start from day 1. So, let's assume that we want to understand how this menstrual cycle is taking place. We're going to use the name of Mary. Let's try to assume how this menstrual cycle is taking place in Mary. What is going on? So from day 1. We're going to assume that menstruation has started. Remember, it's a cycle. So you can always start at each and every point that you want. It's a cycle, right? I've just decided to start using the menstruation part because I feel it would be easier for you to get the concept. So we're going to start from day 1. So day 1 up to day 5. You can see day 1, day 2, day 3, day 4, day 5. So from day 1 to day 5, we are saying in these 28 days, from day 1 to day 5, there will be menstruation. Now, if there is menstruation, this is why we are seeing this picture here is showing the endometrium lining shedding off, and there is blood that is coming out there from the vagina there. It's just showing that there is the menstruation from day 1 up to day 5. Don't worry. At this particular point, I've not said anything about the hormones. I've not said anything about progesterone or estrogen. No. I just first want you to grasp the concept with respect to the number of days. Those things to do with hormones and everything, they're very simple. We'll talk about it. So, from day 1 to day 5, that will be the menstruation days. Now, I also like to state that it's not always that it's going to run up to day 5, or maybe it's always 5 days. No. Others it's going to be 4 days, others 3 days and everything. There are a lot of things that influence these different, menstruation, days. So from day 1 to day 5, there's menstruation. Now, you ask yourself, will somebody keep on having this menstruation phase forever? No. So one of the things that from day 1 to day 5, menstruation normally must stop within 5 days. Then ask yourself, because remember I said, whenever you're talking about the menstrual cycle, you're supposed to be remembering the uterus. Then what is happening in the uterus after the menstruation phase? After the first 5 days are done, because menstruation phase is done, then what is happening in this particular uterus lining? So from day 6 up to day 14, you can see here, in the uterus, it's not shedding off. There is no menstruation. It simply means that this layer that was shedding off here, bringing about formation of blood flow and everything, it will start growing back again. In anatomical terms, we say it will start proliferating. It will start regenerating again. Preparing, remember the definition we said, we want to prepare a female reproductive system for pregnancy. So after the first 5 days which are involving menstruation, if they are done, the uterus lining will be like, okay, I have not given up. The lining will be like, I have not given up. I will start proliferating again. So from day 6 up to day 14, you expect again the uterine lining, specifically the endometrium, to regenerate or to proliferate again. So with the menstrual cycle, I'm done from day 1 up to day 14. We've decided that from day 1 up to day 14, the first 5 days there will be menstruation, where the lining or the endometrium lining is going to be shedding off. That is in the menstrual cycle. Then from day 6 up to day 14, there will be regeneration of the endometrium lining. It will start growing back again. So that's what's happening in the menstrual cycle. So we are done from day 1 up to day 14 in the menstrual cycle. Then I said, there is also something that is taking place in the ovarian cycle. From the very day 1 up to the very day 14, there's something that is going on. If in the menstrual cycle there is menstruation, After menstruation, there's proliferation of the endometrium lining. Then what was going on in the ovaries there? Because we also have the ovarian cycle. So on the ovarian cycle, we're going to start again from day 1. So if you've got a piece of paper, write day 1 to day 14, menstruation or a menstrual cycle. This is what is taking place. Compare again, ovarian cycle, write day 1 to day 14, what is going on. Because these different cycles take place simultaneously or at the same time. So let's begin. So in the ovarian cycle, I'm also not talking about the hormones here. We have not yet reached that point. I just want you to have an idea of how these days are running. So in the ovarian cycle, from day 1 up to day 14, just think of it. I'll just ask you to think of this as just one big phase. From day 1 up to day 14 as just one phase, which we call the follicular phase. So in the ovarian cycle, from day 1 to day 14, just write it as a follicular phase. To make life simple, what is happening in this follicular phase? In this follicular phase, what is happening is that there is growth of what we call the primordial follicles. I'll talk about it very soon, where it comes from and everything. So there is growth of what we call the primordial follicles. Remember, at day 14, there should always be ovulation, mostly, right? So there should always be ovulation. But if you ask yourself, at day 14, where is that particular ovum or oocyte that this particular female or male is releasing? Where is it coming from? It's because before this day 14, there was a follicular phase that was bringing about development and maturation of this particular ovum, such that at day 14 now, it's going to be ovulated. So from day 1 up to day 14, there will just be follicular phase, which is just bringing about development, maturation, and then indeed at day 14, bringing about ovulation. So you've seen that from day 1 to day 5, as the uterus lining was being shed off, in the ovarian cycle, the egg started what? Maturing. Then in the uterus, there was just menstruation. Up to the time again, from day 6 to day 14, the lining of the uterus again started growing back again. And then the ovaries, they just kept on maturing this egg, such that by the time it's day 14, you can even see from day 6 to day 14, you expect the uterine lining to be it has grown back again, it has proliferated. So at the time the egg is coming, it's finding this lining properly fit for fertilization. I'll go in details very soon. So basically, that's what has happened from day 1 to day 14 in the menstrual cycle and in the ovarian cycle. Then I'll go back again from day 15 up to day 28. I'll talk about what will happen again in the menstrual cycle. Then I'll finish with what will happen again in the ovarian cycle. So I hope you're following. All right. So from now day 15 up to day 28, because we're going back there. So at day 1 you start again. We say that from day 1 to day 5 in the menstrual cycle there was menstruation. Then from day 6 to day 15 there was proliferation of the endometrium lining. It was basically growing back again. So after it has grown back again, what will happen to this endometrium lining? Is it that from day 14 there will be another menstruation again? The answer is no. Because for menstruation to take place again, you must run again from day 14 until to day 28 again. So it starts at day 1 again. So from day 14, you don't expect at day 15 to be menstruation. No. So what will determine what is going to happen in this uterine lining is if there is pregnancy or there is no pregnancy. But what I want you to understand is that what will start happening now in this uterine lining, there is what we call secretory phase. Secretory phase. Because at day 14, you expect that the ovum is going to be ovulated by the ovaries. Then this lining now in the uterus is like, okay, I'm expecting the egg to come. So should I start menstruation? Of course not, right? You don't want this particular ovum which is coming to find this lining bleeding here. No, you don't want to do that. So what you start doing is that it will start undergoing what we call the secretory phase. So this lining here is going to be producing proper nutrition. hoping or making the environment in this uterine cavity suitable for fertilization and implantation. So it will make sure that there are proper nutrients there. Okay, it has even closed things there such that it can prevent another another sperm from entering. So basically, what is happening from day 15 up to day 28 is what we call secretory phase, where now this lining now, after regenerating, it will just now start making the environment inside this uterus suitable for implantation. I'll talk about what is happening and what hormone is bringing about making the environment suitable very soon. But just get this concept that from day 15, if at all, actually this doesn't matter whether there's fertilization or not, there will still be this secretory phase from day 15 to day 28, where you're just making the environment in the uterus suitable for implantation. Then now, if you reach day 28, let's assume that in this lining, right, the uterine lining, if from day 15, 16, 17, 18 up to 28 is just preparing, anticipating for this incoming ovum that has been fertilized, then at day 28, it finds that there was no fertilization. Imagine it has just been working from day 15 up to day 28, nothing is happening. Then this lining is something is going to happen again, because fertilization did not occur. And this cycle is influenced by hormones. And if these hormones don't show up somewhere or they don't support this, then again the menstrual cycle is going to start again. Because it will be like, imagine, I just worked for nothing. From day 15 to day 28, I was hoping there'll be fertilization, there'll be implantation, nothing happened. What do? It will start being shed off again. And then the menstrual cycle just keeps on going like that. Then let me also talk about what is happening now in the ovaries, in the ovarian cycle from day 14 up to day 28 again, because something is also taking place in the ovaries. So in these ovaries. So we said in the ovarian cycle that from day 1 to day 14, there is what we call follicular phase, where this particular follicle is just being developed. Then at the end of the day, at day 14, it will become a mature ovum, then it's going to be ovulated. After ovulation, what is happening in the ovaries? That is the question. Because this is now the ovarian cycle. So let's assume that day 14, there is ovulation. Because ovulation will always be there. Ovulation will always be there. It's not like fertilization, which can be there or not. Ovulation will always be there. So at day 14, there is ovulation. Let's take for example. Now, you ask yourself, what is happening inside these ovaries after they ovulate this particular ovum? They will start undergoing what we call the luteal phase. The luteal phase. I'll talk about where the luteal term is coming from. But for now, all I want you to know is that as this ovum is developing, from day 1 up to day 14, it grows in what we call a follicle. So that follicle now that ovulated this particular ovum at day 14, it's still existing in the ovaries. So that follicle will not degenerate, or it will not be broken down or die at all. It's still going to be there. The reason why it's being there is that it's also expecting fertilization to take place. And then this particular follicle now, after ovulation, we call it the corpus luteum. That's why we're saying the luteal phase, because luteum simply means yellow. So that particular follicle, we call it the corpus luteum after ovulation because it looks yellowish. So that follicle now is the one that will be influencing what's happening in the ovaries from day 15 up to day 28. So that particular corpus luteum now will be producing a specific hormone that is going to be making sure that the environment inside the uterine lining is safe for implantation. Remember I said there was a hormone that was making this environment suitable here. That hormone was coming from the corpus luteum. It makes sense very soon. So in the ovarian cycle now, the corpus luteum is going to be it will survive from day 15 up to day 28, just producing a specific hormone which we call progesterone. Very soon I'm going to show you how it comes about. Making sure that the lining inside here is making sure that the environment for the uterus is suitable for implantation. So from day 15 to day 28, there will be what we call the luteal phase. The luteal phase is being brought about because of the corpus luteum, which is producing progesterone hormone, which is making the environment in the inside the uterus suitable for what? Implantation. Now, in the ovarian cycle again, at day 28, imagine this corpus luteum was just there producing this progesterone hormone, hoping that there is fertilization. At day 28, no fertilization. Then the ovarian cycle is like, again, there is no fertilization. If it checks on the neighbor there, the menstrual cycle, there is already menstruation. It's taking place. It's like, even there nothing happened. So even the ovarian cycle will be like, okay, even me, I have to start again. Because now there was no fertilization. So I have to restart again. So it's going to start again from day one, preparing another developing ovum. And then the cycle just keep running like that. That's how the concept of menstrual and ovarian cycle are interlinked. So, from this particular concept that I've explained, it's very easy for you as a student to come up with what we call the safe days, okay? To come up with what we call the safe days. So you've understood that from day 1 in the menstrual cycle to day 5, that's menstruation. Day 6 to day 14, that's proliferative phase, where the just lining is generating. So if I was to ask you a question, what makes you to understand better about the safe days are the following two concepts. One, you must understand how long can a sperm or spermatozoa survive inside this particular environment, the uterus lining. How long can it survive inside here? And science says it's up to 5 days. Then another thing that should also make you understand how safe days work is that if this particular ovum is ovulated at day 14, how long can it survive after ovulation? And the answer is about 12 to 24 hours. So it's about half a day to one complete day. So if I was to ask you a question, let's assume that in this particular menstrual cycle of Mary, let's assume that there's sexual intercourse at day 10 there, at day 10. So from day 10, if we count from day 10, day 11, 1, day 12, 2, day 13, 3, day 14, day 4. Okay? What I mean is this. If the sexual intercourse from day 10 of this particular cycle, if you're talking about the ovarian cycle, it simply means that you're just remaining with 4 days to ovulation. Now, if you ask yourself, if this particular Mary had unprotected sex with a boyfriend at day 10, and then what you also know is that the sperm can survive up to 5 days. So, the time that Mary is going to ovulate at day 14, it's possible that she can get pregnant. Why? Because that sperm can survive from day 10 up to the day Mary is going to ovulate at day 14. Because if you count the days from here, it's day 1, 2, 3, 4. The sperm is even remaining about 1 extra day because we said it can survive up to what? Up to 5 days. So you can see that 4 days before the actual ovulation days, those days are very dangerous. And somebody must not think of having unprotected sex, especially if they don't intend to get pregnant. Why? Because the sperm can survive up to 5 days. The day this particular woman is going to ovulate, boom, fertilization is going to take place. And then the man will be like, no, this happened this day. It's not possible because you told me there was this. You still had time. No, you need to understand that the sperm can survive or can go up to 5 days inside the woman's genital organ. So it simply means that if there's unprotected sex, if you're talking about the ovarian cycle, at least if you want to consider it being safe, it must be at least 10 days away from the ovulation phase. So you subtract from here. So 14 minus 10 days, you go backwards here. At least 5 days, okay? At least from 14, you count at least about 7 days backwards. 1, 2, 3, 4, 5, 6, 7. So it simply means day 7, day 6, day 6 and day 7, there is a very small chance of pregnancy because you are too far from the ovulation phase. Even if there's unprotected sex here, the sperm can't go from day 6 up to day 14 alive. That's about 8 days or 9 days now. That's not possible. according to science. Otherwise, these things, they do change because they're influenced by hormones and everything, and it's not always that it's 100%. They must be reviewed. Again, here at day 14, if there's ovulation, so you don't expect to have unprotected sex at day 15. Why? Because we said the ovum can go up to 24 hours or 1 day. So if you have sex here because there was ovulation the previous day, unprotected sex, then of course you expect to be pregnant because the sperm here will still be alive. At day 15, 16, it's to still be alive. So you want to make sure that after this ovulation day, I should give it at least 24 hours for me to have unprotected sex. Otherwise, there will be fertilization. So these are the concepts that I want you to get on this particular slide. Okay? Next, when we meet, I will talk about what you have to know now in terms of the hormones, okay, in terms of how these eggs develop, how menstruation is going to come about and everything. I've just given you the basic information, and from the few that I've talked about, I believe by now you've got an idea of how this cycle works. Make sure to subscribe to this YouTube channel so that when I upload the last part of this particular session, you have got full information about it.